We talked about patient experience. Well, it has been decades that you can buy shoes and clothes online, and healthcare should be as easy and as straightforward as Zalando or Saranza. And that's the challenge of Health Yourself. And I'm happy to welcome on stage Anna Rosenkrantz, co-founder and CEO of Health Yourself.
So every day, people in Switzerland and beyond put their health at risk because they choose not to use routine healthcare services. One of those people is a very good friend of mine who's been struggling with infertility completely unnecessarily for the last 2 years. The cause of her issue is chlamydia. Chlamydia is a very common sexually transmitted disease. And a very tricky thing about it is that in up to 80% of cases, it doesn't cause any symptoms. But it can still damage a woman's fallopian tubes and cause infertility. And that's exactly what happened to my friend. There's a very easy solution to the problem. You can just test regularly and easily treat a chlamydia infection with antibiotics. So why did my friend not test? She thought it was highly uncomfortable to have to go to a doctor's office, talk to probably a white male in his 50s, and ask for a test for sexually transmitted diseases. So she just didn't test. And stories like hers is why we've made it our mission to make routine healthcare services accessible digitally and from home, and to eliminate these very common barriers to accessing care, such as having to go to the doctor's office. We started 2 years ago with lab tests from home. We, at the moment, cover about 15 use cases, and originally we started out with the topic sexual health. So how does it work? Basically, you just order your, for example, chlamydia test kit through our website. You will receive it to your home. It includes a unique code, which you use to activate the test online through our IT infrastructure. There, we will collect all the necessary information to be able to do a lab analysis. And then you take the sample from your living room or your bathroom based on the materials and the instructions that we provide with your package. You then package that sample, you drop it off in any Swiss mailbox, it will be delivered to our partner lab, and you will receive your results about 2 to 3 days later online. No need to see a doctor. In the last few months, we've also been trialing our second service, which is medication subscriptions. So this is addressing people who have, for example, chronic conditions like asthma and have to take medication very regularly. Why do we do that? Because we figured out that people really stop taking medication because they think it's too much effort to have to go to the doctor's office to get a new prescription and then get a refill of their medication. And with things like, for example, asthma, this can have really drastic health consequences. So our first use case is a little bit less dramatic, so it's actually a use case for me. So as opposed to my friend, I already have a baby. It's called Health Yourself, and it's taking about 150% of my time. So I have absolutely no interest in extending the family right now. So a very important accessory for me right now is hormonal birth control. And some of the women in the audience might know the journey to get your prescription and your hormonal birth control is just as painful as getting any other medication in Switzerland. So also a lot of unnecessary doctor's visits and paper-based documents. So we tried to make the process more user-friendly. So how does it go? You just go online, you answer a few questions about your health to make sure, so that we can make sure that there are no risks that preclude you from taking this medication. So for example, in the case of hormonal birth control, we need to make sure that you're not overweight and that you don't have any thrombosis in your medical history. And then you select the medication you're taking, you create an account, you take a selfie video with an ID so we can verify your identity, you take a photo of an old prescription, upload it so that we can make sure you've taken this medication before. This request is provided to a doctor, reviewed. If everything's fine, a prescription is issued, uploaded to an online pharmacy, and you will receive your medication about a day later. And if you want to reorder, you can do that with just a few clicks. Eventually, we really want to be able to combine all our services from testing to treatment to provide all-in-one solutions fully digitally for common health concerns, like, for example, our first use case, vitamin and nutrient health. So we already offer vitamin and nutrient testing, for example, for B12 deficiency, vitamin D deficiency, or iron. So now, when you take a test and you figure out, for example, you have a low iron count, this is very typical for women, then you can immediately order a personalized supplement, and then we will will remind you 2 to 3 months later to reorder an iron test to check whether your levels have returned to normal. No need to go anywhere. You can do the entire process from your living room couch. How we deliver our service is that we focus on providing the necessary technical infrastructure and managing and designing these digital user journeys, and then we integrate with existing healthcare providers along the entire healthcare value chain. So for example, all our lab tests are being analyzed by SYNLAB. Some of you might know them. They're one of the largest lab chains in Europe and the biggest lab in Switzerland. But how can we contribute to the healthcare system as a whole beyond improving health outcomes for our customers? So I think our primary contribution can be saving costs. People not using care when they should costs a lot of money. I'm a prime example of that. About 3 years ago, I walked into an emergency room in Zurich with severe chest pains, being a bit short of breath, thinking I was having a heart attack. What really happened was that I'd been putting off getting an iron deficiency test because it was too much effort to go to the doctor for months, and it had gotten so bad that it was mimicking symptoms of having a heart attack. This entire exercise cost me in the Swiss healthcare system over 2,000 francs. If I would have used our service, the entire testing to treatment journey would have cost me less than 200. Of course, this is all purely theoretical until people actually use our service. And I always get a little bit suspicious answers, yeah, but do people really take a sample at home, etc.? Yes, they do. So we've been in the market for about 2 years, and over that period of time, we've acquired 2,500 paying customers, and we think that we should be hitting the 500,000 revenue mark by the end of the year. So we are also doing fundraising right now, since my predecessor also mentioned that. So yeah, happy to talk to you again afterwards over a drink.